One of the biggest taboos when chatting to your trans friends, families, or colleagues is asking about surgery or other medical interventions. Not every trans person wants, desires to make changes to their body. In fact, far more cis people have Botox, facelifts, boob jobs, or bum enhancements than trans people ever will. However, healthcare support is a massive issue. This is what I want to talk to you about today. Firstly, it's a lottery. If your GP or practice is trans inclusive or even knowledgeable around trans healthcare issues. Many GPs, even in 2022, still turn away trans patients and refuse to offer support because it's out of their sphere of confidence. Secondly, the waiting list for gender identity clinics in the UK can run as high as 4 years, in some part of the country higher. That's for the first appointment, and then potentially another 12 to 18 months for the second appointment, and further delays if you need an additional appointment for years and years to come. So the medical pathway for many trans people is in excess of 7 or 8 years from the first point of contact with their GP, provided their GP is receptive. Of course, trans people can go private, and for some surgical interventions, of which there are many the NHS don't fund, it can become expensive. For example, without getting too personal, I have funded my own facial hair, laser removal, which totaled nearly £2,000, plus I was supplemented by additional funding of the NHS for another 12 sessions of electrolysis. I've had 2 hair transplants at a cost of £5,000, and I know friends that have paid even more for that. And many other trans people have funded their own surgical treatments, totaling well over £15,000. So being trans is either hard work getting through the system or it's expensive. So the big issue that I'd like to talk to you about today really is it's about not having timely access to support, the long waiting list, the variable support depending on where you live or who the surgery you engage with, the treatments and the incorrect belief that our medical professionals are fully up to speed with the needs of trans and non-binary people. So what can you do as an ally? I'd like to ask you to step up in support of your trans and non-binary family, friends and colleagues. Be aware of the challenges that we face accessing medical and healthcare support. Speak up where you can. Advocate on our behalf. And most importantly, be there and offer your strength when people are feeling at their most vulnerable or frustrated by the healthcare system. My name is Joanne Lockwood. I use the pronouns she and her. My organisation is See Change Happen, and you can find our website at seechangehappen.co.uk. We are inclusion and belonging specialists that also promote transgender awareness to businesses and organisations.